That major cut to Medicaid spending has members of the disabled community concerned. Tonight, political reporter Jessica Arp checked in with a local couple to find out what the bill would mean to them. Jess?
Well, this Whitewater couple and adults and children who are disabled across the state rely in many cases on Medicaid funding to pay for services that keep their lives running, and they're worried if funding is cut over time, so could their ability to live in their communities.
Thank you for calling. This is Stephanie. How may I help you?
Stephanie Helly has worked a call center job from home for the past 5 years, in part thanks to services she gets paid for by Medicaid.
This helped keep my muscle tone and flexibility good.
We met Stephanie and her husband Dan 2 years ago when they were fighting against changes to state long-term care programs. Now we meet them fighting once again.
I didn't predict that Dan would be fighting for his life, with cancer.
Dan was diagnosed with tongue cancer last year that's now in remission. His care, treatment, and rehab also paid for by Medicaid.
So basically, you saved my life from cancer just to tell me that now, because it's more expedient for a bunch of rich folks to have their tax cuts, that now I get to go live in a nursing home for the next 40 years? I don't think so.
He and others in the disability community are concerned about a proposed 26% cut by 2026 to Medicaid funding, which in states like Wisconsin largely pays for services for the elderly and disabled.
This is a fundamental change to a 50-year-old program. And once the funding for Medicaid is changed, we will be living with impacts of that for generations. The time to be concerned about it is now.
Stephanie and Dan say they recognize that some may be concerned about funding levels of the program or waste along the way, but offer this for those who are wondering what to do about it.
If you had a leaky pipe in your house, would you just burn your house down? No, you would go in and diagnose and try to improve the problem, fix the problem, find different ways to do that.
So we did ask Senator Ron Johnson today what he would say to disability groups that are concerned about those Medicaid cuts and the ability to stay in their homes.
I've been highly concerned about what happens to that community in terms of work opportunities, as well as how do we actually pay for the long-term care. So there's nothing that I see in the Senate bill that would affect supporting those individuals on a long-term basis.
So then we asked why the disability groups by and large were so concerned about this bill. He said he believed it was because of amped up rhetoric and demagoguery on this issue.
Jessica Arp in the newsroom. Jess, thanks.